Hi, everyone, and welcome. I'm so glad you've joined us today. We're going to have a great conversation about how you can get the quality, restful sleep you crave and deserve. If you're new here, I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis and bone health exercise. And my special guest today is Dr. Andrea Matsumura, MD. She is a board-certified sleep specialist and menopause expert. She's a co-founder of the Portland Menopause Collective and the creator of the Sleep Goddess MD Dream Sleep Method. I love that name, by the way. And the Sleep Goddess archetype. The Portland Menopause Collective is a dedicated group of women physicians from different specialties leading and advancing awareness and providing high-quality, evidence-based education for the public and healthcare professionals about menopause health. So if you're interested, check them out on Instagram. And Dr. Matsumura is working on developing, soon to be open, her concierge practice supporting people in sleep and midlife care. Dr. Matsumura, thank you so much for joining me today.
Thank you so much, Lisa, for having me. I'm excited to be here.
All right. So let's get right down to it. We live in a culture that is driven, do more, grind it out, burn the candle at both ends. We can sleep when we're dead mentality. How wrong are we getting this?
So wrong. We are so wrong. Yeah, it's time to put that to bed, pun intended. We really do need our sleep. Sleep is what I call the juggernaut for everything else to function better in our life. If we're not getting enough sleep, it's like our body is playing a song in the wrong key.
Right. So my understanding, it's not just one of the pillars of health, but the foundation for all those other pillars, right? You can be working on your nutrition and working on your exercise, but if we're not getting sleep, we're really not getting the benefits as well as we could of all those things, right?
Yeah, exactly. You know, there are 4 different sleep stages, and really there are a few that are quite important to help us repair, recover, everything that we're doing during the day. So when, our exercise, our, any stress, oxidative stress that we put on our body, the stages of sleep that are really important are stage N3, our slow wave sleep, or what people will see on a wearable called deep sleep. And then REM sleep. And REM sleep, I like to think of as the emotional regulatory sleep phase. So it helps us regulate emotions and consolidation of memory. And then N3, or slow wave sleep, is really focused on the physical components for repair in our body. It does do some memory, and actually that's also when we clean out the waste products of our brain, but those two are really, really important. However, coincidentally, the stage that we're in the most is called N2. So N2, or our light stage of sleep. So I want to say this because people will focus on their numbers, and I really, everybody is using a wearable. A wearable is a device that you have on your body, whether or not it's a watch, a bracelet, or a ring. And those provide you with information, and typically they break down your sleep into light, deep, and REM sleep. And a lot of people will come to me and say, I'm getting a bunch of light sleep. Well, yes, because when we break down the different sleep stages, we get lights. The N2 sleep is lumped into the light stage of sleep, and that is what we're supposed to be getting the most of.
Okay, very good. That helps to put that in context. Right. So being irritable and having more kind of a emotional dysregulation can be an effect of poor sleep, and as well as consolidating memories from the day, repairing, regenerating cellular repair from any trauma or stress that we had in the day. So much in that healing process is part of our rest. What are some of the other downstream effects that may show up for people that are chronically sleep deprived?
So chronic inflammation, chronic pain, dysregulation of emotions, more difficult to control diabetes, higher risk for arrhythmia. There's all kinds of things that can happen. It's just difficult to manage everything else in your body and mind when you're not getting enough sleep.
Yes, absolutely. So, okay, great. You talk about inflammation, increased inflammation. Is that one of the connections or possibly one of the connections to bone density and osteoporosis that could be impacted by poor sleep?
Yes. So, for instance, we know that in patients who have obstructive sleep apnea, because of all the oxidative stress and systemic inflammation due to the inability to oxygenate, then that puts a strain on our ability to provide laying down bone, and actually contributing, it can contribute to changes in your bone density.
Right. Okay. So people that are listening that are interested in helping to optimize their bone health, improve their bone density, or prevent bone loss, sleep is going to be really another powerful tool in their tool belt.
Right. We know that in chronically sleep deprived individuals, bone turnover is imbalanced. There's higher bone turnover rate when you are chronically sleep deprived.
Okay, I think that is critically important. The other part that goes with that, so, we have different sleep demands and needs and abilities through our lifespan. I know as a teenager, I could sleep in, and as a postmenopausal woman, I could not. So what is the effect of menopause on sleep, and what are women experiencing perimenopause and menopause? How is that impacting their sleep and sleep quality?
Yeah, so we know that estrogen and progesterone both play important roles in the sleep cycle because they contribute to the factors that promote sleep. Specifically, melatonin is one that I have been focusing on. So estrogen and melatonin actually have an intimate relationship in how melatonin is produced. And we know that with a decline in estrogen, it contributes, it's one of the factors for a decline in melatonin. And then we also know that progesterone plays a role in the potentiation of GABA, which is our relaxation, right? And so when we lose progesterone, we lose that whole relaxation stage, that mode that we go into to help us get to sleep. So that affects your ability to get to sleep. And then staying asleep is also affected because we have all of this dysregulation of temperature. Temperature is actually really important in achieving sustained sleep. So when we have temperature fluctuations, it affects the ability to our sleep maintenance is what we would call it. So the ability to stay asleep.
Right. Because some people will have one or the other in their insomnia pattern. Some are difficulty falling asleep, and others difficulty staying asleep. So temperature, like if it's too hot, typically, right, it's hard to stay asleep.
Yes. So at baseline, we always tell folks, regardless of what stage of life you're in, that you want your environment to be dark, cool, and quiet. And so clearly, when you're in this perimenopausal, menopausal state, you may have some dysregulation of your ability to control that temperature, right? To put it simply. Right. Yeah. So then you will have more middle of the night awakenings. They can be quite disruptive. And why is that important? Why are middle of the night awakenings important? Because we cycle through our deep sleep and REM sleep. And so it's more about the quality versus the quantity. I know a lot of people will focus on the quantity, but we also need to focus on the quality of that. So if we're waking up in the middle of deep sleep or we're waking up in the middle of REM sleep, that really affects our ability to get back into it. And so then you statistically or proportionally, rather, you have less deep sleep and less REM sleep. And we're already at a disadvantage. We have less deep sleep as we age. And the more research I do, it is related to melatonin.
Okay. So I want to get to melatonin.
Yeah.
But first, let's talk, how does hormone therapy play a role in helping with these sleep problems?
Right. So when we provide women with hormone therapy, we're restoring the balance to help us get back to sleep, which is why so many women that I see initially, they come with sleep problems, and I realize that they're in a perimenopausal stage or a menopausal stage. And the first step is clearly evaluating. That's why I developed the whole dream sleep method, because it really is a holistic approach to touching on all the areas that may be affected by sleep. So once I am able to evaluate people's sleeping environment, emotions, their daily activities, right? What their archetype is, because sometimes people are out of line with their archetype, or which is your circadian rhythm, and then medical conditions, then I typically start someone on hormone therapy. However, a third of my patients will continue to have sleep issues even after the start of hormone therapy. And we've balanced all of that out. And the outlier, the one thing that's still bothering them, is their sleep.
Okay. So let's talk about melatonin then. So what is the role of melatonin? And I've seen so many different pieces of information about low dose and slow release and high. Right. So shed the light.
So here's the issue. There's not a whole lot of research. There's enough out there, but we really need better research around dose and around whether or not sustained release or immediate release is recommended. The evidence that is out there is focusing. I'm finding that sustained release is more in line with our physiology. And melatonin is actually released from our pineal gland, which is one of the glands in our entire body that gets calcified rather early on in our life. So then we have a reduction in melatonin production up to 50% by age 50.
Wow.
That's huge.
That
right?
Is huge. That is
because what melatonin does is it is helping our circadian rhythm be in sync with, and every cell in our body runs on a circadian rhythm. So if we don't have enough melatonin production, then we're not getting into the correct stages of sleep. Our sleep, what we call architecture, which are all the different stages of sleep, becomes disrupted. And so then that is this vicious cycle where we have this chronic oxidative stress, and it's in line with longevity, right? So all of this talk around longevity is now, to me, this lines up with, well, should we be replacing melatonin, because it is so important in our ability not only to get to sleep, but to stay asleep. So this is why the sustained release melatonin, I feel, based on the research that is out there, is much better. And in fact, in the EU, they recommend 2 milligrams sustained release melatonin in all patients age 55 and over who are struggling with insomnia. So they're a little bit ahead of the game here. What we have done in our country, in the United States, is anyone can sell a supplement, right? And so you want to make sure that you are looking for third-party testing, that it is true what is on the bottle, the ingredients, and the higher doses. Unfortunately, we've been allowed to sell really high doses. That is not how we make it in picograms in our brain. It's sold in milligrams. So anywhere between 1 and 3 milligrams is pretty much, 3 milligrams is, to me, the right dose. I wouldn't really take more than 3 milligrams of melatonin.
Wonderful. Great advice. So some people think that they should expect the melatonin to make them groggy, sleepy. That's not how it works, right?
Right. It's a chronobiotic. So that's the fancy word for saying it's a timing hormone. So we release it almost 4 hours before we actually fall asleep. So it is helping to trigger the circadian rhythm to help us then fall asleep and stay asleep. So typically I recommend people taking melatonin, if they're using it for sleep, to take it 2 hours before they go to bed. If they're using it, to adjust their circadian rhythm. So in other words, if they have a circadian mismatch, classically somebody who's a night owl who actually has to get up early for work, then I have them take it 4 hours before bed.
To try to align that clock better.
Right.
So it's a timing cue that helps our body get the cues it needs to start to wind down, right?
Yeah.
Okay. Is there anything else that we can do in our environment, like exposure to daylight, that helps trigger that automatically?
That's a good one. So you and I both live in the part of the country where it's really light out for about 90 days, and then it's really dark for about 9 months. So melatonin is released through a process called dim light melatonin onset. So it is triggered when we have an absence of light. All right, if you're living somewhere where it's daylight out and it's 8:30 still, then naturally if you're out in the sun, you're prolonging your bedtime, right? So what I tell people is that resting environment and your daily activities, so the D and the R of the dream method, you really want to make sure that you're preparing yourself for sleep, that you're developing some way to wind down. So especially in the summer in the Northwest, I am guilty of it. It's gorgeous outside. I'm outside and it's 9 o'clock and it's still pretty sunny out. So then I wonder why I can't fall asleep until like 12 o'clock.
Yeah.
Right?
Yeah.
So you want to remove light from the evening if you need to go to bed earlier. Right. And then you want to expose yourself to light in the morning because that anchors your circadian rhythm. So you asked me about what we could do to prepare for sleep, and that's really developing some sort of routine or ritual that allows us to disconnect, disengage, remove light from our life. And the biggest offender of excess light across the country is our phones. So that's my plug. I really would love to start a movement of no phones in the bedroom. No phones in the bedroom. Or if you can't be without your phone in the bedroom, it's got to be plugged in across the bedroom, like away from your bed. We don't want people being able to reach for it easily. And people will say, well, I use it as my alarm clock. And I'll tell people, well, then put it in the drawer of your nightstand or put it across from your bed and have the volume on higher. There's, many different levels of alarm clocks that are provided within our.
Yes, we have lots of options there, but the key is that light from the phone is really, it's promoting wakefulness, not sleepfulness, right? Rest.
Right, because we have cells in our eye that are called glia cells that directly connect to the wake center in the brain. So then our body is kind of confused. Wait, did you want me to go to sleep? Did you want me to stay awake? What do you want me to do? Because you've got this bright thing right up close shining in my eyes.
Right. I'm fatigued, but I'm going to rally for you because this is the stimulation you're giving me. Right.
Yeah.
Got it. So one thing I have not heard you mention is medication like Ambien or Lunesta or Trazodone. What are those helpful? How do they affect sleep quality? I've used every single one of those. I say not for a long, long time. I'm happy to report. But I never felt rested on those medications.
Yeah, rightly so. And there's a reason why I don't mention them, because they don't really work long term. All of those medications, if you take a look at the fine print, specifically the ones that are labeled use for insomnia, it's all for acute insomnia, which is short-term insomnia. They're all labeled for use of 2 weeks or less.
Wow.
So if you're needing to use a sleep aid longer than 2 to 4 weeks, that's your red flag to say, maybe I need to look at the root cause of what's behind my wakefulness. And those medications, the data that is out there that's published, they increase total sleep time by max 40 minutes. So it's all about perception. So here's a classic story that I was on repeat, or is on repeat when I talk to patients about their sleep study. Those folks who say there's no way I can do an in the sleep center sleep study without a sleep aid, I will never be able to fall asleep. So we typically use something like Ambien for for helping people get to sleep. And they will have middle of the night awakenings, and they don't even know it because they don't remember it. So I have to show them on a polysomnogram where they were awake, and they'll say, no, I wasn't. And I'll say, well, yes, you were. You just don't remember that you were awake. And that's the beauty of these medications. You don't know that you're awake during the night. And that's the danger of these medications.
Yeah, for sure. Yeah, I know as I really looked at the behavioral aspects that I could do, which like exercise, meditation, exposure to daylight, and that routine that you talked about, transform my sleep beyond anything else that I tried. So, and I hear from clients too, well, that glass of wine really helps me to fall asleep, or that THC or that CBD. But we know that alcohol actually doesn't do that. It doesn't improve our quality of sleep, does it?
No, it doesn't. So it does contribute to that relaxation phase, that ability to feel like we're relaxed enough to fall asleep. But then, alcohol has a half-life, and it just causes significant middle of the night awakenings, and it reduces REM sleep. So then you have to recover the next night and do what we call REM rebound, which is make up for the REM sleep you lost the night before because you didn't get enough REM sleep. So then your body has to recover. And a lot of people, when they wake up the next morning, they just don't feel great at all. They feel like they didn't get enough sleep. And that's typically because they didn't get enough of the right stages of sleep.
The right stages. Yeah. So both alcohol and cannabis can interrupt those stages of sleep?
Yeah, there's so much mixed data out there about CBD, CBN, which is specific for sleep, but it's not shaking out that is the magic, the silver bullet to help us get to the right stages of sleep. What I will tell people is that your brain is capable of it. There is a neurological pathway in your brain that is triggering sleep. And we just have to wake up that sleep. It's kind of like maybe it's under construction. It's a highway that's under construction. We need to finish the construction, the building of it, or open it back up. And we do that with a variety of interventions. And the one treatment, the most successful treatment for chronic insomnia is actually cognitive behavioral therapy for insomnia. So all medications aside, it's really about retraining your brain, addressing what is causing the hyperarousal and hypervigilance in sleep, and then giving your brain permission to fall asleep and stay asleep.
Yeah, it takes a little work to get through that, but yeah, it's incredibly effective method. CBTI, right? Is that how?
Right. Yeah. Cognitive behavioral therapy for insomnia, or CBTI. You're right. So here's the other thing that I tell people is that you're coming to me and you've had 20 years of insomnia, and clearly what you're doing right now isn't working. So maybe CBTI is not comfortable. It's not a couch to 5K. It's a couch to marathon. But what if you invested the next 3 to 6 months helping yourself get better sleep to set the rest of your life up for better sleep?
Yes, absolutely. There's really, it's what's the best that could happen, right?
Right.
Yes. Wonderful. So talk a little bit about, are there any other deficiencies or supplements? Sometimes I hear magnesium thrown around for sleep. Anything else that people can do to help them in that kind of nighttime ritual?
The most important thing is to listen to your body's cues. So just like how we listen to our body for hunger, for fullness, we kind of have these routines around when we know we need to brush our teeth. We listen to our body when we have to go to the bathroom. That's a signal. That's the same thing as we have to listen to our body around sleep and then start preparing ourselves. And we really ignore a lot of our cues. When you think about little kids, right? So, many parents are always bothered by the fact that their child doesn't want to eat. And my child used to always say, my tummy says I'm full. And then when he's right. Yeah. And then when he was really hungry, he would eat a lot. So he was listening to his body cues. And I think as children, we probably listen to our cues a lot better than as adults. We get trained to turn off those cues. I know you and many professionals, we turn off that cue to go to the bathroom, right? We have too much to do. So we don't pay attention to that cue. And then it's, like 5 hours in, you're like, oh my God, I haven't gone to the bathroom.
Right. Or had a drink of water.
Or had any water, right? Yeah. It's the same thing around sleep. That's why I always say we have the tools in our brain to help us get to sleep and stay asleep, but we have to listen to them. And so that's the key.
I love it. So our body has been communicating to us. It's trying to communicate to us, but we've been ignoring those messages for so long that we just press on. So reconnecting with those cues and that sensation and developing that new pattern can make all the difference.
Yes. And understanding if there are other things that are affecting sleep, like anxiety, like this fight or flight, that sympathetic overdrive that we see, the autonomic dysregulation in women who are menopausal.
Oh, absolutely. 100%. I've experienced that. Talk about sleep archetype.
Okay. So there are 5 circadian rhythms that are identified through the American Academy of Sleep Medicine and, our definitive guide. There are 3 that are very common within our society. And so typically people fall into one of those 3 buckets. They're either early birds, they're night owls, or they're falling right into what I would say societal norm, our society, because we're an early-ish society. So I love Greek mythology. That's why I call myself the sleep goddess. And so then I developed these 3 archetypes. So if you're an Artemis, you're an early bird. That's somebody who wants to go to bed by 9 o'clock. They get up at 5. Okay. If you're an Aphrodite, you're more of a night owl. That's somebody who will say time and time again, they do their best work at night. They like burning the midnight oil, and they typically don't want to fall asleep until midnight, 1 o'clock, 2 o'clock, and they would rather wake up at 8, 9, or 10. And then there are people who fall right into societal norm, and those are the Athenas. And those are people who typically will go to bed at 10, wake up at 6, go to bed at 11, wake up at 7.
Yeah, I can wake up at 5 without an alarm, but at 9 o'clock, I'm like, it's bedtime. That's what my body tells me. I can't fight it. Makes it hard to go to the theater.
Exactly. Those are the folks where you say, oh my gosh, I got this reservation at the cool new restaurant. It's at 8:30. And they're like, I'm out. I'm not doing that. I'm not going to go eat at 8:30. I'm going to bed.
Right. So that's just how we're wired. That's how we're internally made. So we can make some small adjustments to that, but you can't really change your archetype, can you?
You can't. You can fake it out. So archetypes or our circadian rhythms, we're born with them. So we have clock genes that are housed in the hypothalamus of the brain. Our pacemaker for circadian rhythms is basically the suprachiasmatic nucleus, which is in the hypothalamus. And so sometimes clock genes are passed down. So a lot of times when people are night owls, they'll say, oh yeah, my mom was always, an insomniac, when in fact they were just a night owl living in an earlier society. So those folks, I will tell them, you'd be living your best life if you lived in France, Spain, Italy, because those are late cultures. You try to go get a dinner reservation at 6 p.m. in Spain, and they look at you like you're cuckoo, right? They're like, no, we're eating at 9. What are you talking about? So why is that important? It's important because then that's what's governing all the rest of the circadian cycles in our body. And so if we're misaligned, then everything is a little bit off, and we can't do the repair that we need in our body. And then we have more oxidative stress. We have an imbalance rather of hormones around like our hunger cue, our satiety cue, we become chronically sleep deprived.
Yeah. Yeah. Okay. So you have developed the dream sleep method.
Yeah.
I love that name of it. I mean, it just sounds so like restorative just hearing the name. So please share with us, what is the dream sleep method and how do you help your clients achieve their goals?
Right. So, I developed it, just a little bit of background, because I find that a lot, no shade to my sleep colleagues, but, because of the way that our healthcare system is developed, we focus on disease, right?
Mm-hmm.
We focus on one particular process, and that disease that is focused on is typically sleep apnea. So when people say, well, I don't have sleep apnea, or when physicians will say, well, you don't have sleep apnea. So then we tend to say, well, okay, move on. We don't have, no, you don't have sleep apnea. But in fact, there's so many other things that can affect sleep. So dream sleep method is something that I developed so that I can provide this holistic, whole person approach to helping your sleep. So the D stands for your daily activities. Are you running around all day? Are you anxious? Are you not giving yourself breaks? What's happening in your daily life that's not allowing you to then have a routine for helping wind down and get yourself ready for sleep? And then resting environment. Is your resting environment noisy? Do you have kids in your bed? Do you have a 100-pound dog in your bed? Like, what's going on in your resting environment? Do you have a partner that's snoring really loudly and keeping you awake? And then emotions. We all know that anxiety and depression, past trauma, PTSD, all play a big role in one's ability to get to sleep or stay asleep. Sometimes the defense mechanism was to stay awake in the middle of the night because that's when the trauma happens.
That's
Okay.
protection. Right. Yeah.
Right. And then the archetype, which is your circadian rhythm, because some people aren't in tune with what their circadian rhythm is because we kind of shove down people's throats in our society, being an early bird, not getting enough sleep. So then their archetype gets buried and they don't really realize when they should be going to sleep and when their optimal sleep opportunity is. And then the last one is medical conditions. I mean, do you have sleep apnea? Do you have restless leg syndrome? Do you have a hormone deficiency? Do you have some other autoimmune disorder? Do you have a musculoskeletal disorder? All these things can contribute to your inability to get good sleep.
Wow. That sounds fantastic. I love it. Holistic. You're looking at the whole person, their environment, their behavior, their health conditions to find the solutions to get quality, natural sleep.
Yes.
Right. Restorative sleep. For people who've been sleep deprived, sometimes you don't even remember how good it feels to be rested.
That's right. And our bodies are fabulous at helping to, I'm trying to think of the right word, compensate. Our bodies can compensate for a long time. And so what happens when people come to see me is that they'll say, well, I've been doing this for 20 years, but it could be this sentinel event that then just tips their body over the edge and their body basically says, I'm not doing this anymore. And so what they've been doing is compensating for decades sometimes. And then finally it all kind of falls down. It's like a house of cards. It all falls down and now they're at a loss and they don't realize that it's been years of compensation that has allowed them to move forward. And then the last trigger was what kind of blew it all up. And then they come to see me.
Right. It reaches a certain threshold that the body cannot continue to compensate.
That's right.
Right. Well, this has been so informative, so helpful. I have learned so much. Is there any other great piece of advice you'd like to share, and how can people find you?
So you can find me on my website, which is www.sleepgoddessmd.com. I have an archetype sleep quiz, so you can kind of figure out what your circadian rhythm is. I've got a bunch of blogs on there to talk about the top 10 things that are most common around sleep. That's how you can find me. I'll be opening up my private practice at the end of the summer. And then, of course, the Portland Menopause Collective is having their yearly conference, which is going to be happening in March 2026 on the coast of the Oregon coast. So more to come. The last thing I would say is that don't be so hard on yourself around the kind of sleep that you're getting. Every 15 minutes counts. One of the things that's been happening in our society is with the inundation of information and with social media, you know, you get all of these sound bites. And so then you're left with all the things you're doing wrong, right? So then you get fixated on, I must get enough sleep. And then we have a society that wears a bunch of products that tells them, that primes them how well their sleep was. And that condition is called orthosomnia, the fixation on getting perfect sleep. We don't need to get perfect sleep. We just need to have forward motion.
Right.
So
yeah, that's wonderful advice. I love that, because so often we do blame ourselves. We judge ourselves. We're so critical of how it's going. And then that adds to that tug of war that we get into every night when we go to bed.
Yeah.
Thank you so much. Thank you for all the work that you do to support women in midlife and educating the public and other healthcare providers. We're grateful. We're really, truly grateful for all you do. Thank you for joining me today.
Well, thank you, Lisa. Have a good day.
You too.